Hello, my name is Alexa Rose, and today I would like to discuss healthcare delivery and quality outcomes for BSN 410. So first, I would like to start out talking about the World Health Organization and its importance. The World Health Organization was founded in 1948, and the organization connects nations, partners, and communities all over the world to promote health and serve the vulnerable. The World Health Organization focuses on healthcare in all countries with a common goal of improving access to essential services across the world. The World Health Organization also responds to global emergencies. Some of these emergencies include natural disasters, conflicts, and displaced populations. And the World Health Organization will provide aid, such as medical supplies, equipment, medical professionals, and support for local governments. With that, I would like to discuss the importance of Sustainable Development Goals. Sustainable Development Goals provide a plan to achieve a better and more sustainable future for all. These goals address the global challenges that humans might face. Some of these challenges include poverty, inequality, climate change, environmental degradation, peace, and justice. And there are 17 Sustainable Development Goals, all of which are interconnected with the common goal of achieving a better and more sustainable future for all. There are some statistics that provide evidence on how important the World Health Organization and Sustainable Development Goals are. For example, 146 out of 200 countries have already met or are on track to meet the SDG target on under 5 mortality. Additionally, effective HIV treatment has cut global AIDS-related deaths by 52% since 2010. One Sustainable Development Goal that I would like to discuss today is Sustainable Development Goal 3. Sustainable Development Goal 3 aims to ensure healthy lives and promote well-being for all people at all ages. So encased in Sustainable Development Goal 3, it's broken down into multiple sections, and 2 ways that this Sustainable Development Goal is important for improving global health is one, SDG 3.5 focuses on substance abuse. So the goal of SDG 3.5 is to strengthen the prevention and treatment of substance abuse, which includes narcotic drug abuse and harmful use of alcohol. And also SDG 3.3, which focuses on infectious diseases, and the goal is by 2030, in the epidemics of AIDS, tuberculosis, malaria, neglected tropical diseases, combat hepatitis, waterborne illnesses, and other communicable diseases. So with Sustainable Development Goal 3, I wanted to see the United States current outcome measurement indicator and see if the United States is on track to meet Sustainable Development Goal 3 or not. So with my research, I found that in 2021, the United States had a Sustainable Development Goal Index score of 74.43. This score measures the progress towards the United States achieving all 17 Sustainable Development Goals. The United States has achieved many of the indicators within Sustainable Development Goal 3. However, there still is room for improvement to be made in areas such as traffic deaths, life expectancy at birth, and gap in self-reported health status by income, which are all encompassed in the sections of Sustainable Development Goal 3. With that, I would like to discuss 2 nursing roles and how they might be able to help the country achieve Sustainable Development Goal 3. The 2 nursing roles I would like to discuss today are the public health nurse and the psychiatric mental health nurse. In the United States, psychiatric mental health nurses promote well-being through prevention and education. Nurses also aid in the assessment, diagnosis, care, and treatment of mental health and substance use disorders. Psychiatric mental health nurses can help individuals during recovery, provide education to patients and families, and participate in crisis intervention and stabilization. The psychiatric mental health nurse can play a detrimental role in achieving SDG 3.5, which is under Sustainable Development Goal 3, that addresses substance abuse. Another nursing role that can help the country achieve Sustainable Development Goal 3 altogether is the public health nurse. The public health nurse plays a crucial role in disease prevention and promoting the health of individuals throughout communities. Public health nurses provide care, which can include immunizations, preventative care, and general health education. And it's evident that these nursing roles play a huge role in attaining Sustainable Development Goal 3, which aims to ensure healthy lives and promote well-being for people at all ages. I would like to also discuss health disparities. And with health disparities, I chose one population to focus on health disparities that might be occurring in this group. So a health disparity refers to a preventable difference in health status, disease burden, or access to health care between different groups of people. Health disparities often impact vulnerable and underserved populations that might have limited access to health care. So for example, American Indians and Alaska Natives face many health disparities. A study conducted compared 13,064 electronic health records, testing the relationship between an American Indian and Alaska Native health outcomes. This study shown that American Indian and Alaska Native adults are 50% more likely to be obese than non-Hispanic white adults. Some examples of health conditions that obesity can contribute to include hypertension, diabetes, and high cholesterol. A potential cause for this health disparity might be related to the forced relocation of American Indian and Alaska Natives, which created forced deprivation of their established self-sufficient economies, diet, and lifestyles. And as a result, American Indians faced financial destitution. According to the study, the poverty rate of American Indians and Alaskan Natives is the highest among races at 25.4%. Therefore, many American Indian and Alaskan Natives struggle with income, access to education, and access to health insurance, which can make them more susceptible to health disparities such as obesity. 2 nursing strategies for improving the health disparity include health education and health promotion. Education is something that nurses play a huge role in. And nurses can educate on health, disease, and management. Education can include monitoring of symptoms or chronic health conditions. Education with that can be how to use medical equipment such as a blood pressure cuff or a glucometer. Additionally, a nursing professional can teach the importance of medication adherence and what medications are used to treat. And to address health promotion, nurses can educate individuals on sedentary lifestyles and the importance of lifestyle modifications. It's very important to combat periods of prolonged activity, and nurses can place emphasis on that, which is crucial to combating the many health risks that are associated with sedentary lifestyles. And this education can promote health in all individuals, but also potentially help address the health disparity with American Indians and Alaska Natives.